My name is Dr. Joseph DeBay. I'm a board-certified nutritionist. This is the first in a series of case studies in functional medicine, where I'm going to show you what it takes to find out what's going on with people to get them truly better. Susan was a challenging case. She came to me with a very long list of symptoms. She hadn't felt well in years. She had a lot of nagging complaints. She had lifelong hypoglycemia. She would have to eat every few hours or she would be exhausted. She was diagnosed with polycystic ovary syndrome, premenstrual dysphoric disorder, a lot of mood problems, allergies, gastroesophageal reflux, breast, thyroid, and ovarian cysts. Laboratory testing revealed the reactive hypoglycemia. She was advised to eat complex carbohydrate, high fiber foods every 3 hours, and this helped temporarily with her energy. She did indeed have a seesaw in her blood sugar after eating carbohydrates. When she came to see me, she was taking metformin, a drug for blood sugar, spironolactone, a drug to help reduce male hormone, Prozac for her mood, Prilosec for reflux, Claritin for allergies, Flonase for allergies, Tricycline to further try to manage the hormones. Susan's symptoms included fatigue, stress, 8 out of 10 was her rating of stress, diarrhea, belching, gas, abdominal pain, bloating, constipation, heartburn, hair loss, brittle nails, inability to lose weight despite eating well and going to the gym, carbohydrate cravings, excessive hunger, headaches, dizziness, confusion, mood swings, anxiety, depression, poor memory, sinus congestion, rapid heartbeat, joint pain, menstrual cramps, irregular periods, facial hair, and acne. I was thinking that our workup was going to find Susan to have low cortisol because of her reactive hypoglycemia, because of her low blood sugar. But cortisol turned out to not be the issue in her case. We did a number of tests on Susan. We had her fill out some symptom questionnaires. In her case, the valuable information came from blood testing. We did comprehensive routine blood testing and put her results into a computer program called Blood Detective. The Blood Detective program has 2 sets of reference ranges. In the gray, we have the laboratory's normal reference range. On the right, we have a healthy, optimal reference range that picks up more subtle problems. In Susan's case, there were several important abnormalities that we picked up. The biggest one was the CRP, the cardio-CRP. That's a marker of inflammation. Susan had a lot of inflammation going on. Her immunoglobulin A in the blood was low. We also did a stool test. One of the things measured on the stool test was immunoglobulin A. That also was low. So Susan apparently had a genetic inability to make this important antibody, immunoglobulin A, which binds to, neutralizes, and helps get rid of foreign invaders, bacteria, yeast, parasites, viruses, toxins, food antigens. So we began to piece together the puzzle of Susan's health. There are many things that can cause inflammation. A lot of inflammation starts in the intestinal tract. Most of the immune system is clustered around the intestinal tract. So if you want to investigate an immune issue, it makes sense to look at the intestinal tract. One of the big factors with the intestinal tract is what we eat. If we're eating foods that the body doesn't tolerate, that the immune system doesn't tolerate, that can produce immune system imbalance. Inflammation can spread from the intestinal tract to other organs in the body, including the brain, and it can produce impaired cognition, altered mood, poor memory, and even neurodegenerative disease. So Susan was started on an anti-inflammatory elimination diet, exercise, and a number of nutritional supplements targeted based on her lab test results and her overall presentation. And we continued to do more testing. The anti-inflammatory elimination diet is a whole foods diet, unrefined, a lot of fruits and vegetables. It eliminates red meat, eggs, alcohol, among other things. One of Susan's supplements was a medical food called Ultra Inflammex Plus 360. This reduces inflammation. It has a beneficial effect on improving autoimmune conditions, and Susan also had an autoimmune condition. Ultra Inflammex Plus 360 works in other ways. It helps the body to detoxify and helps to heal the intestinal lining. Insinase is a patented nutritional product from plant extracts that helps to improve the way that the hormone insulin works in the body. Biodemulsion Forte is a well-absorbed emulsified form of vitamin D. EPA DHA 720 is a high-potency fish oil product. And Susan was also given selenium. She came back 4 weeks after beginning this program, and her progress was tremendous. She came into my office all smiles and told me that I asked her how she was doing, and she said that her energy was through the roof. She couldn't believe how much energy she had. A few of her complaints we didn't inquire about at this follow-up. All the other complaints were either gone or much improved. Fatigue was gone, stress was gone, diarrhea was improved, belching, gas improved, abdominal pain, bloating, and constipation were gone, heartburn was gone, hair loss was gone. Inability to lose weight, carbohydrate cravings no longer an issue. Excessive hunger, no longer an issue. Headaches gone, dizziness gone, confusion gone, mood swings gone, anxiety and depression all gone in just 4 weeks. Poor memory was no longer an issue. Sinus congestion, not an issue. Rapid heartbeat, not an issue. Joint pain, not an issue. Acne was improving. All this through a natural approach. Diet, exercise, nutritional supplements. A wide variety of seemingly unrelated symptoms were improving, and she was discontinuing and cutting back on medications.